Dr. Rebecca Miller. I'm the Director of Nursing Practice at Methodist Hospital Northeast in San Antonio, Texas. The co-authors for this study and presentation are Dr. Karen Wambach, Professor Emeritus at the University of Kansas Medical Center, and Dr. Danielle Olds, Professor in the School of Nursing at the University of Kansas Medical Center in Kansas City, Kansas. This study explored the relationship of the nurse manager practice environment with burnout. The basis for this study stemmed from previous studies that examined the clinical nurse practice environment on burnout. Researchers found that clinical nurse practice environment was a predictor of stress and burnout. Burnout is significant because research findings associated with this construct were turnover, lack of organizational commitment, and higher sick calls. When describing their practice environment, researchers found nurse managers included relationships with staff, physicians, and the directors, latitude for decision-making, workload and work-life balance, resources and budget, interruptions and pay as some of the primary concepts. The purpose of the study was to examine the relationship of the nurse manager practice environment using the nurse manager practice environment scale on 3 dimensions of burnout from the Copenhagen Burnout Inventory. This was a cross-sectional descriptive study. Participants were emailed a red cap survey link with 70 items, which included demographics with both the CBI and the nurse manager practice environment scale. It was open for 3 weeks and sent out during the first peak of COVID in the South Central Texas area. I know it was hard. Pearson's correlation and descriptive statistics were used. The sample included 23 nurse managers across 7 hospitals. The majority of the nurse managers were bachelor's prepared at 56.5%, with 26.1% who were master's prepared. About half were certified, and the nurse managers represented were primarily located in a suburban urban area with bed sizes 100 to 299 and greater than 300. None of the nurse managers were from a magnet facility. However, about half were from a Pathway to Excellence facility. In looking at the results of the study, there were statistically significant findings between the work burnout and 8 of the nurse manager practice environment subscales. Also with client burnout and staff relations subscale, and then the personal burnout, which was the 3rd dimension, and cultural generativity subscale of the nurse manager practice environment scale. Relationships with the nurse managers that they have with staff is advantageous element of their practice environment is what we found. This was a very small sample size, so we considered this a pilot for future larger studies. And then this was also done during our big COVID surge, so something else to take into consideration. Thank you for your time.